Good afternoon to everybody east of Thunder Bay, and good morning to the west. Welcome to the Keeping Seniors Safe webinar, designed by patient partners and offered by Patients for Patient Safety Canada. Our goal today is to explore practical solutions drawn from real-life experiences, noting how COVID-19 has impacted seniors and their loved ones, as well as healthcare workers and leaders. My name is Christopher Thrall. I'm the Communications Officer with the Canadian Patient Safety Institute. I would like to welcome you on behalf of our technical host, Janet Bradshaw from CPSI. Please write any questions that you have in the chat window directly to me, Christopher Thrall. They will be compiled and provided to our speakers at the appropriate time. If you run into IT difficulties, please connect with us in the chat box and we would be happy to assist. If you miss part of this webinar, or if you want to share your learnings with others in your team or organization, please know that it is being recorded and will be available on our website within the next week. There will also be a quick survey at the end of the webinar. We will be hearing from a series of outstanding speakers today who will each identify safety risks along with practical solutions for seniors who live at home, in residences, and in long-term care facilities. Please allow me to take a couple of minutes to introduce them before I hand this over to your facilitator. Our first speaker will be Sharon Nettleton, speaking about safety at home and in the community. Sharon is a founding member and former co-chair of Patients for Patient Safety Canada. She is also a founding member of Imagine Citizens Collaborating for Health in Alberta, a Scarborough Community Coffee Clatch organizer, and Scarborough Community Association board member. Welcome, Sharon, and thank you so much for joining us. Our next speaker is Judith Maxwell, who will address safety in seniors' residences. As a teacher, writer, and researcher, Judith has consulted with health professionals, politicians, and consumers from coast to coast. Her husband has been a hospital CEO for 30 years, and she has had the opportunity to volunteer and participate in a number of patient programs in chronic, rehabilitation, and acute care settings. Thank you so much for being here, Judith. Our final speaker is Donna Davis, who will discuss safety in long-term care facilities. She has nursed for 40-plus years, mostly in a rural community and in a long-term care facility. Donna is a past co-chair for Patients for Patient Safety Canada and remains active with the group on several committees. Donna has moved beyond the loss of their 19-year-old son, Vance, as a result of medical error, to embrace partnership with the healthcare community to ensure the patient and family voice is heard in the development of policy and programs aimed at improvements in patient safety. Thank you so much for joining us, Donna. And now it gives me the greatest pleasure to turn things over to our facilitator, Bernie Weinstein. Bernie retired in 2002 from 32 years with the Canadian National Railway in roles from civil engineer to director of operating and capital budgets. He has been a member of Patients for Patient Safety Canada for 7 years and a volunteer at the Jewish General Hospital since 2003. He has also delivered health issue seminars in Canada and the US. Please remember to write any questions in the chat window directly to me, Christopher Thrall. And now I think they've heard just about enough from me, Bernie. Why don't you take things over?
Good morning, and I'm sorry that you can't see me online, but I'm a senior, and maybe that's part of the reason seniors have problems. We can't seem to get connected. Let me apologize again for not being online, but rather being on the phone. First of all, I have to make a confession. I'm a senior. I live at home. During this pandemic, I go out walking at least once a day. I have lots of support. In fact, my children and grandchildren won't allow us to go shopping or even go out to the bank or anything like that, and I have no significant medical issues. I'm pretty well off. However, we have a sister-in-law and a friend who live in a senior residence. Both of them have been locked in to their room. One has a room that's 400 square feet, the other one has a room that's 500 square feet, and they haven't been out of their rooms literally for 8 weeks. Their meals are delivered, their medications are delivered, they can call on the phone, they can watch TV, but that's it. They are locked in. They can't even see their doctors. My mother-in-law lived for about 4 years in a long-term care facility. We went to visit her every day. I can't imagine not going to visit someone in a long-term care facility. It's really their only contact with the world. We've seen some good things during this pandemic. We've also seen some bad. And certainly when you look at seniors, Chris, can you show the first slide? We make up about 6 million Canadians. That's about 15 or 16% of the population. By 2030, 10 years from now, we will be making up, there'll be about 9.5 million Canadians, and we'll be about 23% of the population. By 2050, we'll be more than 26% of the population, and I can tell you that right now, there are more seniors in Canada than there are juniors, people under 21. The interesting thing is 90% of the COVID-19 deaths that have occurred in Canada have occurred in seniors. We are disproportionately affected, primarily, they'll say, because of the number of seniors who have underlying conditions that need to be addressed, but also, I believe, because of the conditions that exist in the centers where seniors live. The goal of this webinar is to bring together through the eyes of the patient. We would like to explore how to keep seniors safe in their home, in senior residences, and in long-term care facilities. We know that we need to understand the current norms and how these have changed because of the COVID-19 pandemic. We're going to focus on communication, medication, infection, falls, and again, what I think is the most important thing, isolation and communication. We know that the federal government and many of the provincial governments plan to enact legislation, make changes in how seniors are treated, both in their homes, in senior residence, and in long-term care facilities. And we want to start the process of representing the views of seniors as seen by their families, by seniors, in formulating these new standards and ensuring that these standards are maintained and that these standards are meaningful and do something for seniors. We have 3 excellent speakers today. I'd like to start off by asking Sharon Nettleson, who looks after in-home services for seniors, to talk to us first. Sharon?
Thanks so much. Can everyone hear me?
You bet we can, Sharon. Thank you.
You're muted. I'll use the telephone because sometimes it's clear. Thank you so much, Bernie. COVID-19 has impacted my own family and certainly the community I live in greatly, as well as the city and province I live in. I'm in a community called Scarborough here in Calgary in the province of Alberta. I have 3 parents. My own parents, Peter and Marilyn Nettleton, living in their own home, 80 plus, heading into their 90s, and a mother-in-law living in a seniors facility that was very fortunately locked down very early on. And fortunately in the sense that there haven't been any residents impacted, but there have been staff impacted, of course, and greatly impacting the residents by not being able to visit family. I'm really here to let you know about some of the initiatives that as a volunteer I'm involved in. And if you want to go to the next slide, as a volunteer in the community of Scarborough. And what we're doing, 3 of us helped initiate this project 6 years ago to try and keep seniors engaged in the community of Scarborough And the repercussions now during COVID have been greatly appreciated in trying to keep our seniors safe. We're a small community of 300 homes in an inner city neighborhood in Calgary. Roughly 15% of the population living in our community are seniors, and some of them are extremely old and living in their own home. We have at least 10, could be more, but according to the statistics that we have, who are over 90 living in their own home. So 6 years ago, as I mentioned, 3 of us got together and just thought it was important to try and keep the seniors in our community of Scarborough engaged. And one way of doing that was through personal meetings about between 4 and 6 times a year. But to try and keep the personal face-to-face with our seniors. And that we titled A Coffee Clutch. So when COVID hit our city, our province, our country in mid-March, excuse me, it was very easy here in our community to engage and connect with seniors and those who were also at risk and for other reasons. Personal calls were made to each family or person listed in our Coffee Clutch directory, and also to those in the neighborhood who we also knew might be at risk. At the same time, we also put a call out for community volunteers. And these would be people living in the community, known to those needing help, but who had agreed to either shop or arrange for shopping, take people to necessary appointments, arrange for medication, and sometimes it was just keeping in touch, friendly visits at the porch side or telephone calls. In terms of action, some of the initiatives that the 3 of us got going on right away was beyond these personal phone calls and finding out what some of the needs were, then connecting volunteers to those needing help. And some of the necessary actions were around medications, helping those at risk receive their medications in their own home without them having to leave their home. Things that they might do to maintain proper diet. Other activities would have included things like getting hearing aids cleaned, adjusted, so that those most at risk could communicate. And the telephone is so important with their friends, with their family, and especially with medical personnel. Something else that we noticed right away was that some of our seniors most at risk were concerned about their health, were concerned listening to the news, reading the papers, about having things in place, things like wills, personal directives, and especially contacts, lists of people who they would normally contact, family members, pastoral care, churches, synagogues, temples, that sort of thing. And they, for many of them who were especially at risk, wanted that information to be shared with their loved ones, and especially if their loved ones lived outside of the city and sometimes outside of the province. Keeping people mentally well was something we noticed early on. The spectrum went from this isn't really happening and life is going on as usual and I will get in my car and do my own errands, all the way to I'm afraid, I'm not leaving my home, I'm not talking to anyone who comes to the door, I'm not touching anything that comes to the doorstep. What should I do? So some of what the Coffee Clutch organizers and our volunteers were doing was helping to interpret and also to share messages that were coming first from Dr. Teresa Tam, our federal Chief Public Health Officer, and then from our own provincial Medical Officer of Health, Dr. Dina Hinshaw. And through email blasts and also in our own community, newsletters, and sometimes in communication that had to be dropped off either at the door or in a mailbox or communicated over the telephone to seniors, was around what these directives were, what we were being asked to do. Stay at home as much as possible. If we were out walking and staying physically well, keep at a distance. Wearing masks, and now especially as things are starting to open up in the community, and absolutely lots of hand washing and cleanliness around the home. So those are some of the things that the Coffee Clutch we're doing here in the community of Scarborough, and some important initiatives that have helped to keep our seniors safe. And I can go into some of the details later on in our Q&A process. Thank you.
Sharon, this is Bernie Weinstein. Can I ask you a sort of a simple question? Do you think that all of the seniors who were in their homes and who couldn't leave fully understood the problems, the scope of the problem, and the actions they had to take? Or did it take repetition and repeatedly explaining this to them?
Thanks, Bernie, and that's a very good question. It took repetition, I would say, and not just to the seniors, but for the whole community. I think, and especially among some of our younger families, making residents understand the importance of this pandemic, making them understand the importance of spread and how spread was occurring, and what they had to do, what we all had to do to keep the community, to keep the province, to keep our nation safe. So it took repetition.
Sharon, do you think your coffee clutch concept can be implemented everywhere and is sustainable even beyond this COVID-19 pandemic?
Another really good question, Bernie. I'll answer the second part of your question first. Our community is fairly tight-knit, and geographically we are somewhat enclosed by an expressway on the one side, by a major street on the other, by a park, if you like. So geographically, we're a pretty tight-knit community and have always been that way. We have a community directory, so residents can see names and addresses, phone numbers. So that helps to make us a tight-knit community. There's schools in the community. There's places of worship in the community. Again, other components that keep us, or most of us, integrated physically and geographically. So in terms of the Seniors Coffee Clutch, it began 6 years ago, and it will continue. It's a great opportunity to keep our older residents connected, and so there's no reason to believe that won't continue. There's already workshops and seminars, ideas being planned for when we can open up and meet again. That's great. In terms of the first part of your question, can it be replicated in other communities? Well, I think it can. It takes, ours began organically. It didn't begin with provincial or federal government funding. It began with the idea that people needed to be connected. We aren't funded per se. We use our community association money, if you like, minimally, to pay for some coffee, but it's all run basically as volunteers. We use a community hall when For some of our meetings, we meet in other people's homes, gardens, outdoors, that sort of thing. So could it be replicated? I think it could if it were at a small enough level. So however a community defines itself geographically or along other dimensions, absolutely. But it does take some leadership in getting it going. Does that make sense?
Yes, it does, Sharon. Thank you, and I think that's excellent. I'd now like to shift, if we can, to our next speaker, Judith Maxwell, who's going to focus on medication issues, specifically as it relates to a senior's residence. Judith?
Thank you, Bernie. Yes, I have been asked to talk about medications while living in a senior's residence, and yes, I live at Royal Gardens in Peterborough, Ontario, and while I hope that some of the information that I share will be very general and answer some of your points that are important to you, I think we need to remember that each province and each area where you live, they have their different rules and regulations. So I want to make quite sure that I give general information. Living in a senior's residence is very helpful in many, many ways, especially regarding medications for those people who need help. As a seniors, when we age, our needs for medications change, and primarily for myself, I have the family doctor and have slowly added specialists as I have got older. I am now 83, such as cardiologists, neurologists, etc. And each addition results in medication changes. And some new ones have been added, some old ones stopped, and so on. So it's very, very important to be up to date. The residents who live here, half of the residents are like me, and they look after their own medications. They are able to contact their doctors, get renewals, contact the pharmacist, etc., and they manage their own medications. The other group of people are those who require help with the management and the administration. And the nursing staff here will look after them, and they will keep the supplies and of their medications. They will help them keep lists up to date, and they will deliver them at meal times and make sure that everyone has their medications, or at night times before they go to bed. So talking about medications, I would like to think that there's a little bit more than just being prescribed a medication, ordering it, and taking it. I think medications are very important to me, as I have had in the past some problems with my medications. So there are 4 topics that I'm just going to touch on. One is keeping current. Number 2 is a list. Number 3 is renewals and possible shortages. And so keeping current was really, really important. And I think this is important as it is related to living in a senior's residence. It is very easy to just think that everything is taken care of, but one must consider that first they have to have an up-to-date list of their medications. And in order to make sure that my medications are correct for me and current, I have always chatted with my pharmacist, and he will give me a medication reconciliation, and he will discuss about changes, proper use, what to monitor, what to follow up, and so on. And I can then ask for any appropriate comments or questions that I can share with my family doctor or nurse practitioner for confirmation. It is important to be able to work with the community of people who've supported you before you go to as seniors residents. The most important thing that they all compliment me on is that I have a complete and current list. I have listed the medication, the dose, the time taken, and a renewal date. And this must include also the next item, which is all the over-the-counter medications that I might like: vitamins, eye drops, nose spray, skin creams, etc. They are important to you too when you are living within a senior's residence, because they are not easily accessible, so leave them on your list. The last thing that I make quite sure that I have there is a list of any adverse reactions or allergies or unrelated symptoms that I can discuss with the pharmacist and the doctor too and take care of. It is very, very important that you are well informed for yourself with your medication needs, and this will help the staff who are there to help you. We have a wonderful staff of nursing, and there's a doctor we can approach and meet with if necessary. And there is a corporate pharmacy that if you do not have your own pharmacy, you may also have the staff at your residence keep you up to date and order for you. I know that there are some people who have said, those of my friends who are looking after their own medications have said that they've only been allowed for a 30-day supply of their medication when they have asked for a renewal. And then they have worried about possible shortages. So I've done a little research into it, and I found that safemedicationuse.ca has advised that this change to only allow a 30-day supply of your medication is not happening because of a medication shortage. It is there in place to prevent one. So rest happy. I also was able to receive a newsletter from the Canadian Pharmacists Association, and on March the 23rd, they wrote, as a result of COVID-19, pharmacists have seen a tremendous surge in the demand for medications and medical supplies. They are working to carefully manage their medication inventories to protect against the real risk of shortages. So I want to assure people that there is probably a very comfortable investigation into shortages, that they are not going to run into shortages. And so I was very happy to get that information and share it with you.
That is fantastic. Thank you so much, Judith. Maybe we can explore that a little bit more in some of the questions that'll come up. Bernie, I think we have enough time for maybe one question for Judith before we can move on.
Great. Thank you.
Judith,
thank you very much, Judith.
Judith, the problem that I understand some seniors have is renewing prescriptions. In other words, they have a prescription that lasted until April the 15th, and then they couldn't get to their doctor on April the 15th in order to renew it. In Quebec, pharmacists are allowed one monthly renewal. But of course, on that basis, if that was me, I'd be out of luck right now because May the 15th has come and gone. Do you have any comments that you can make about that?
In safemedicationuse.ca, it's very, very interesting. They have a full page on this, and they recommend 7 days before your prescription runs out that you call your pharmacist and or your doctor and you alert them that this has happened. I know that my pharmacist will call my doctor and ask about a renewal. And I believe I have also heard that there is a possibility that a pharmacist can give 1 month before you are cut off if you can't get that renewal. My doctor is very easy to approach by telephone, and he will actually book an appointment by phone for me, and so I will get a full appointment time, and we discuss that then. I presume I have not heard of any problems with some of my friends, even as the more elderly than I, that they have had problems with getting renewals.
Thank you, Judith. That's excellent and gives me great comfort. Our next speaker is Donna Davis, who's going to talk to us about long-term care centers. And I'm sure we all have heard the horror stories about these facilities. And I guess, Donna, not only do we need to talk about how to keep seniors safe, but also how to ensure that the staff, the limited staff in each of these centers, stay safe. So if you could talk to us now about that, I'd appreciate it.
Absolutely. Thank you, Bernie. Can you hear me okay? Just a sound check.
I'm good.
Yeah. Oh, okay. Thank you very much. First of all, I want to thank everyone for attending this very important webinar at an absolutely unprecedented time in our history in our country. And I want to give a big shout out to all the familiar names I see. I snuck a peek at the attendees, and I see Carla Williams in Newfoundland. I see Johanna Trimble in BC, and many people in between. And a very special attendee I saw is the daughter of one of our residents. Barb lives in BC, and her wonderful mother is one of the residents at our long-term care facility. So thank you, Barb, for attending. As we know, and as Bernie has alluded, as all the speakers have alluded to, COVID-19 is very, very dangerous and harmful to our senior population. So, of course, being a long-term care manager, that was, so upsetting for me as a manager, and to the staff too, and to the families of our residents. We're a very small facility in southeastern Saskatchewan, so I know that some of the measures we have taken were much easier for us than they were or would be for larger centers, but I do believe by following these, we can help to mitigate the harm to our seniors. One of the first things we did was on March 13th, we had a directive to contact all our families and put up a poster saying that visitors, while we weren't restricting them, we were certainly speaking to them about their health before they came in to our facility. And that's really no different than it always is. We're always aware of people who may be bringing something into our facility. So we always ask them not to attend if they have any signs and symptoms of illness at all. We also have a hand hygiene station right at the front door, and we ask them to use that as soon as they come in. So that was on March 13th. March 17th, that order or directive was expanded where now we had no visitors at all. And again, we phoned all the families and told them of this change because, of course, communication to the families is so very important, and to the residents as well. Some of our residents, we have to reinforce that. We have to reassure them and, of course, tell them that we will make sure that they stay in touch with their family through FaceTime, through iPads that were donated to us by a company, through phone calls, however we could, window visits with the window closed. People have been doing that as well. So we also didn't have visiting professionals come in because we didn't want anything brought into our facility. Even myself and my staff that are in the front office area, we made arrangements so that we did not go down into the care area where our residents were. Myself as manager, sometimes I have to go down there, but took all precautions, hand hygiene, masking, etc., before I went down there. Then on April 3rd, we actually got a public health order from our chief medical officer that our dining was to be decreased. At first it was 25 people, then it was to be decreased to 10. Only 10 people in the dining room at a time, and that included the staff that were there giving assistance. So as you can imagine, we had to do a lot of rearranging and figuring things out. And again, for us, a small facility, it was a lot easier than it was for some of the larger facilities, but I know the managers and the staff were doing everything they could to adhere to that policy. At the same time, our staff were then told that we had to wear street clothes to work, change into our uniforms when we're at work, and then change back into street clothes when we left, and then we had to wash everything that we had worn immediately. It was the same with our lunch. It had to be brought in a plastic bag. We were not allowed to share containers or send our containers from home to the kitchen, etc. On April 9th, all items were not allowed. So we couldn't bring backpacks in. We couldn't bring purses in. Families couldn't send stuff to their loved ones or drop it off. Again, this was all to make sure that we weren't bringing anything into the facility. On April 3rd, we started screening the staff as well. So when they came into the building, we had a separate entrance, only one entrance, people could come in, and we screened them there with a temperature, and we asked them questions. Had they been out of Canada? Had they been out of Saskatchewan, etc.? And if they were deemed fit to work, they went off to work. If there was anything that concerned us, like a sore throat or a slight temperature, whatever, they were, and we had a set temperature actually. Anything above that, they could not attend work. And then they called the OH&S employee health nurse, they called the 811, and were given direction as to whether or not they would be tested. And everybody who ever phoned in sick that they couldn't come into work because they were sick, or they were determined at the screening that they couldn't work, all of those people were tested. There was never a problem with them being tested. So that was great, and they've all come back negative, which is wonderful. On April 14th, then we got told we had to have continuous masking. And our staff have been absolutely fantastic about it. There was concerns at the beginning. They were thinking maybe they should be wearing N95 masks rather than the surgical mask. So that just, it was understandable. There was fear out there. So not just fear, the families and residents weren't the only ones. The staff were fearful too. But it was working through making sure they knew how the transmission was spread, etc. And the staff have been wonderful. On April 28th, we then had to stop sharing staff between facilities. That's something that's done immediately. Any other outbreak, if we have an outbreak in our facility, we immediately stop sharing staff. So this came a little bit later, but I'm sure the experts had their reason. That might be something that's looked at differently in the future. We are going to learn from this. Was everything done perfect? Probably not, but we are going to learn from it. And, if there's a next time, when there's a next time, we will learn from it. On April 29th, we started screening our staff at the end of the shift too. So they were screened at the beginning and at the end of the shift, and that's for tracking purposes.
That's fantastic. Thank you there, Donna. I think it's really, we can maybe move on to a couple of questions if Bernie has some that came from the floor, and then maybe we can move into a larger discussion about the individual issues here. Bernie, did you have a question for Donna?
Donna, I just have one, first of all, a comment. I think what you did in terms of communicating over and over and over is excellent, and I applaud you. I've suggested to the residents where my sister-in-law lives that I would be willing to work with them. And unfortunately, their answer is right now, we're too busy to start anything like that. And I think that's the real issue. I'm just wondering if you think, how easy would it be, along the same lines as what I asked Sharon, how easy is this to expand this sort of communication into a larger facility?
Well, you know, not having worked in a larger facility, as some of them that I'm hearing on the TV, et cetera, I'm sure it would be much more challenging. But, you know, we all have the same goal, and that is to keep our long-term care residents safe. So definitely, as I said, we need to learn from this. We need to start enacting some of these measures sooner, I believe, and I think it can be done. It definitely would take more resources. It's going to take more time from the manager and the staff, and they're going to have to utilize all the resources they can.
Great. I want to thank all three speakers, Sharon, Judith, and Donna. Chris, do you have any questions that come in on the chat room?
Oh, absolutely. There's been a lot of interest in the speakers this morning for me, this afternoon for them. But the first one that came in was actually from Carolyn. She was really thrilled with Sharon's discussion about the coffee clutch and a great support to seniors to keep them socially connected. Have they experienced, however, any medication safety issues that you have heard of, Sharon?
Hello?
You might be muted there, Sharon.
There we go.
Oh.
Medication safety issues?
That's right.
Was that the question, Chris? Yeah.
Yes, it is.
Not per se in the home. Many pharmacies started to take queries over the telephone and deliver medications to residents' home at no cost or minimal cost. So that was a great asset. And then, of course, physicians setting up shop and talking to patients on the phone. And so that has been a godsend, I think. So many of the residents in our community then just calling up their family physician's office and the physician calling them back and seeing them through telephone visits. So
that's fantastic. Thank you so much, Sharon.
We did have
a question.
May that continue. The telephone.
Yes, absolutely.
Access. Yeah, thank you.
Yeah, online and telephone for sure. Judith, we had a question come to you from Joanna. Do you know whether medication reviews are done at regular intervals for those who have medications managed? She was mentioning her situation in BC for licensing, but wondering if the same applies for you in care homes.
I believe the same thing is in my residence as it would be if I were living out in the community. I think that it is a request from the resident, and I'm not quite sure about this, but I believe the resident needs to request a medication reconciliation with the nursing staff. Now, my corporation, my residence works with a corporation, and they will come in and do a medication reconciliation. My pharmacist has suggested that it would be wise to have one every year when you're getting older. I think it is a matter of requesting one, and that's how I feel it's handled here. And I think everybody should know that having a medication reconciliation is a wonderful idea. It's very calming, makes you feel competent and confident that you are on track with whatever it is you need.
If I can step in for just a second, one of the things that I would recommend is that every time you go to a doctor, whether it be for a checkup or, heaven forbid, for something more serious, you bring your current reconciliation. And every time you leave the doctor, you leave a copy of the reconciliation and you get a new one that would include any changes that that doctor recommended. That way, you know that you're up to date, not just once a year, but continually.
Excellent idea. I think Joanna was concerned also about meaningful medication reviews, and I think these frequent ones would definitely help with that meaningfulness. We did have a number of questions that came in for Donna, so let's put her in the spotlight. Teresa was wondering, has the communication between families and residents met resident needs?
Well, I would like to think that it has, and when I do communicate with the family members, which I try to do it about every 10 days, and again, I realize it's probably easier for me with a small number of resident families to connect with, but they are all very appreciative and say that they feel like they have been kept up to date. Because there's so much information, though, out there, people, they're just bombarded with many different measures, many different views about COVID-19. I really think that a written communication with them would be very, very beneficial so that they can differentiate between what I have told them, what we are doing in our home and in Saskatchewan, and what other people are doing or what they're hearing on the news. And I think that would be very beneficial. It's going to mean a little bit more work, but you know, this has affected my family, my personal family, but my residents are my family at work too. So it's very, very important for me to communicate and make sure that they have everything they need.
Donna, do you think you have to communicate with the residents differently than you communicate with their families in terms of the message?
For sure, Bernie. You know, you learn when you're around the residents all the time, you learn what works best for them. And I like to think, and I'm 100% sure that my staff know each individual resident and know the best way to communicate with them. And we don't want to, increase any fears that they might have. So yeah, it might be a bit different for the residents. However, always tell the truth in the ways that they can understand.
Great, thank you.
Great. Thank you so much, Donna and Bernie.
If I could just, Chris, could I just weigh in on Johanna's question about the medication reviews?
Yes, would absolutely love that.
Yeah, okay, because in the long-term care setting, in ours anyway, we do have reviews every 3 months. However, unfortunately, they are more of a medication reconciliation, meaning making sure that the medication on the medication administration record matches what the pharmacist has sent out, more so than a review. And a review is really what is necessary to make sure that people are not left on medications that they should not be on anymore. And do they really need what they've been on for 40 years? Their body has changed, the absorption of medication through the liver has changed as you get older. So, you know, that's a really, really important thing. And it's over and above the COVID. It really has, it should always be there. So Johanna had asked that question, and it is a concern, and it's something we're working on.
That is excellent feedback, and really, really essential to differentiate between those two and really look into meaningful medication reviews, as Joanna suggested, and you followed up. Mm-hmm. Thank you so much. We did have Joanna actually had a question for Sharon as well, so let's open this up here too. Let's get back out to the community and find out, it came up in the newspapers, of course, but were seniors afraid to go to the hospital for problems that arose with whether it's medications, falls, anything, where they might have originally gone to emergency or something? Were they afraid of going in for care?
Absolutely. No question. And this has been a dilemma, I think, nationwide. We've heard situations where people who are unwell have called on volunteers to assist them, and behind the scenes, when we couldn't get through initially to family physicians as they were being connected back to work via telephone, There were our nurse telephone advice lines a bit stranded too, knowing how to direct people. And, the go-to was call 911 and an ambulance will take you to the hospital. And I know of several situations where the individual, the senior, said, no, I don't want to go to hospital. So how do we manage that? And so behind the scenes, contacting physicians and asking what the risks versus the benefits of staying home were. So yes, in answer to that. Knowing ahead of time what and where the best place to receive care and treatment, and knowing that you're not going to be stranded, isolated, alone, would greatly help, and especially in the early days and weeks in these situations.
I'd like to jump in for a second. My wife had to go to the hospital for a test. It's a regular thing, and it's been delayed already twice because of this. And when they finally kind of called her back, she was pretty nervous about going. Well, I can tell you I wanted her to go. Everybody did. But she was nervous. And when she called the hospital, they reassured her. When she came into the hospital, they took extremely good care because of this pandemic to make sure that she was protected throughout the process. And I think that's something that everybody needs to say over and over and over, that the hospitals don't want you, if it's something you need to have done, to put it off, to delay it. It's time to go now, go.
Hear, hear. Excellent advice, Bernie. Absolutely. There was such a culture of fear, and there is still a culture of fear that was really instituted early on. But if you need care, then get the care that you need. Excellent advice. Thank you. Donna, I do have a follow-up from Carla, who was wondering, she identified the moral dilemma between doing the right thing from a safety perspective, but then considering the psychological impact of isolation. Do you have any thoughts, any advice for leaders or providers, rather than family, how they can support one another to manage that conflict dilemma between those two influences?
And that's absolutely true. And what I have seen is that possibly the family members are having the greatest separation anxiety, actually, not being able to see their loved one and make sure with their own eyes that they are doing well. So, we have to do the right thing by protecting our seniors. And to a person, the families that I have contacted, when I say, I'm sorry, we're still in the visitor restriction, you still can't come in, they understand completely. When it came to the masking, there was a little bit of concern about, how is mom or dad going to react to that? And with explanation and really great patience and reinforcement and reassurance from the staff, the residents, we've had absolutely no problems with that whatsoever. You identify yourself, you say who you are. If they don't recognize you with the mask on, I don't know, maybe they think we're better looking with not being able to see our whole face, because sometimes they're great about making jokes about it too. So, they've handled it really, really well. But our main concern and our focus is keeping our residents safe.
Perfect. Thank you so much, Donna. And actually, I'd like to extend that a little bit, maybe reach out to Judith. There was a question about the psychological safety and everything along these lines, the physical safety being so essential. But for you, Judith, do you have any suggestions on sort of how to keep seniors' minds occupied, engaged, active during this isolation period?
Yes, I feel very strongly about that, having been a teacher. Keeping classes and classes over the years busy. I think the residents that I have been in touch with who are staying very positive during this isolation, and actually we have chosen to be isolated, but we are in a lockdown situation. So I do understand the process of staying positive. These of my friends and neighbors have been reading more, knitting more, playing jigsaw puzzles. My husband and I do that. Sudoku, crossword puzzles, music, and art. Or if you have a computer or an iPad, there are such things as YouTube lessons that you can take. I have one friend who actually attends a YouTube art lesson every Friday, and she is producing beautiful pictures. Her a little bit of an interpretation, but that is good. Also, with music, I have someone else, another friend, who has taken an iPad and with a YouTube has a beginning and learn to play music. With the iPad sitting on her piano that had been sitting basically quiet for years, and she is really thoroughly enjoying that. And a lot of the people I know who have a computer or an iPad are using such things as Skype and FaceTime. That is probably association, and staying in touch is probably the number one thing. So even if you do the knitting or the reading you could change books with someone, and so on. To stay positive, it's very important to have people around you and have some things that you enjoy. As my husband says, well, they're time passing, Judith. They help us pass the time. So I hope that are a few things that would help somebody.
Absolutely. Thank you so much for that. That was wonderfully responded, Judith. I do have just one more question left. We have a couple more minutes, and I'd just like to shine the spotlight on our facilitator, Bernie, and ask if you have any recommendations going forward, things to remember, ways to plan, prepare for what's coming down, because COVID's not done. So, Bernie, why don't you take us home?
I have a couple of comments that I'd like to make. First of all, I'm virtually constantly, I'm sure they don't appreciate it, in touch with both my MNA provincially and my MP. And I've really been emphasizing over probably the last 3 to 4 weeks, the need for much stronger standards that the governments need to enact for seniors in order to keep them safe, and enforcement of those standards. And I think it's incumbent on all of us, each one and collectively, to deal with our elected politicians and to work with them as much as possible. For those of us like Judith that are in a private residence, in a corporation as opposed to government managed, I think it's the same thing is important. We, the patients, we, the families of the patients, need to make sure that the people running these facilities are keeping us safe at all times, both in the short term right now, but more importantly in the future. And I compliment Donna especially for having the forethought to do what she did and providing an excellent, excellent model of how any facility, whether it be in-house residence, seniors residence, or a long-term care facility, can seize the opportunity, pick up and walk with it, and make sure that seniors are kept safe. Thank you.
Beautiful.
Thank
you,
you, Bernie.
so much.
If I could just,
oh, please.
Christopher, could I just end with one thing, and that is that the support from our health authority and our leadership has been absolutely phenomenal. It's been very flexible. We've changed the guidelines as we've had to, and the support, I just can't say enough about how they have really run with it and helped to keep our seniors safe and everyone safe in Saskatchewan.
Thank you so much, Donna. That's wonderful. I do see, unfortunately, we are at time, so we do want to respectfully thank Sharon Nettleton, Judith Maxwell, Donna Davis, and of course, Bernie Weinstein for sharing their time and expertise. Thanks to all of you for taking the time to attend. On behalf of me, Christopher Thrall, technical host Jenna Bradshaw, and the rest of the team here, please take a moment to respond to the survey, the poll that has just popped up on your right-hand side before you leave. If you want to continue the conversation started in this discussion, please feel free to send us an email. We will forward your comments and any questions you may have had that were unaddressed onto our speakers. We will also post a recorded copy of this webinar on the PFPSC website in the next week or so. Please join us online at patientsforpatientsafety.ca for additional resources to keep yourself and your loved ones safe. Have a wonderful day, everyone, and we look forward to seeing you again soon. Take care.